This episode is brought to you by Pixel Health. Pixel Health provides strategic planning, clinical workflow optimization, and patient access optimization services to improve patient engagement and operational efficiencies. Leverage their human-centered design services to enhance both clinical and business outcomes. Ready to take your healthcare system to the next level? Visit thisweekhealth.com/pixelhealth today and discover the power of Pixel Health's tailored advisory services. Today on Keynote.
We've admired the problem long enough. What are we going to do about it?
I'm Sarah Richardson, a former CIO and president of This Week Health's 229 Community Development, where we are dedicated to transforming healthcare one connection at a time. Our Keynote show is designed to share conference-level value with you every week. Now, let's jump into the episode. Welcome to our webinar for a conversation built for care. This is about how patient narratives shape operations, technology, and design. We have two incredible panelists lined up, and I'm excited to dive into this topic with you. First, I would like to extend a huge thank you to our panelists for joining us today and sharing their insights. And I'd also like to thank all of you, our listeners, participants, for tuning in. Your engagement makes these discussions valuable, and I'm thrilled to see such great participation. Which, speaking of, we've received a ton of questions ahead of today's session. So if you have additional questions during the webinar, please drop them into the chat, and we will do our best to address them. Rest assured, we've already gathered many questions that our panel will explore today. And a special thank you to our sponsor, Pixel Health. Their support helps us create and deliver valuable content like this. So we're going to jump into today's discussion. Our panelists today, Jill McCormick. She's the co-founder and EVP of Design and Product Development at Pixel Health Labs, a firm known for bringing together clinical, operational, and digital strategies to transform healthcare environments. She has a unique ability to elevate the patient voice and translate it into strategies that enhance experience and improve access, as well as drive measurable outcomes. And then Daniel Small is Vice President of Digital Services at Hartford HealthCare, where he leads with empathy and precision to reimagine care environments across large, diverse systems. His focus is digital places and how they interact with physical spaces. And lastly, before we jump into the interactive part of today's session, I want to highlight a few powerful themes that emerged in our preparation for today. Number one, leveraging influencers within your system. Those trusted voices who shape adoption and engagement creates lasting impact. Second, thoughtful design must precede technology decisions. As one of our panelists wisely said, you don't go shopping before you build the menu. And finally, success requires modular, flexible solutions built to scale that are able to adapt and enable purposeful architecture rather than reactive integration. With that, we're going to move into a seminar-style conversation guided by several questions that were submitted in advance. So Jill and Daniel, let's share your amazing story.
Thanks so much, Sarah. We're so happy to be here. And Dan, thank you for joining as well. It's been amazing being your partner in all of this work, and I appreciate you taking the time to share this with the larger audience. This is a wonderful opportunity.
Thank you for having me. And Sarah, that was a wonderful capture of some of our conversations.
Thank you. I can't wait for everybody else to hear all the amazing things you two have done together.
Awesome. All right, so let's get started. Dan, do you want to kick us off?
Yeah, so let's just start in what we know. You know it as a patient and a consumer of healthcare services, and we know it and we feel it as healthcare professionals. We know we can provide better experiences for our patients, not just in the physical spaces, but online and through communication channels and just in general. We've spent so much of our working lives in healthcare trying to improve experiences, but mostly by dealing with operational issues from the inside out and solving problems one at a time in a piecemeal approach, or potentially trying to boil the ocean, as it were, and solve all problems at once in large failed, or I don't want to say fail, but projects that maybe don't deliver the value that was initially sold to you and intended. And that's really what we're here to talk about is what is the playbook and the recipe to begin moving the needle on solving these experiences. And, what I would say is it's time to take an outside-in approach and take a look at how patients perceive their experiences. And that's going to unlock different problems to solve than you may be used to. And it also then leads to technology selection and it helps prioritize in a way that is just a little bit unique, I think, in our space. We've all done user journeys, I understand, but with the right recipe, I think we can begin to solve these problems more swiftly and effectively. Jill?
This sort of manifests as patient stress and provider burnout. And I just want to share that although this seminar is focused mainly on the patient experience, that the providers feel it too. So when all of these touch points come to bear, our providers feel it too. One of the things in my human-centered design research, when I talk with providers, I often hear some version of, I do more service recovery than I do treatment and evaluation, or something along those lines. And so starting with the patient pain points definitely can solve for our larger system. But as we think about health systems and they want to create all those things that Dan just said about, we know we're not delivering amazing experiences to our patients, but oftentimes as health systems, this is what we have as window into what the patient experience is, are these types of solutions that give us some data, but are we really understanding what's going on? There's a disconnect between what the health systems think experience is and also what patients actually say the experience is. And there's increasing number of studies that talk about how 96% of patient complaints are service quality related. And so those are the things that Dan just mentioned, that sort of this fragmentation in the patient journey that leads to all of these gaps in the patient experience. This follow-up on here is really lack of follow-up, lack of communication, where they're waiting for long times on hold, or they're not actually accessing our health system because there's so many entry points and they're not sure which ones to go through to make that best connection, to best use their time to get close to what their needs are faster. And then, of course, the attitude and obviously cost transparency, which we hear all the time. So that's what patients are saying that patient experience is. But as we think about what patient experience actually is, we know that care quality is important. A lot of those numbers that you just are, those brands that you just saw on that other slide was really just focused on patient linking quality of care to patient experience. And there's a measurement system around quality of care. We know quality of care is table stakes. Our patients know that quality of care is table stakes. And what we're finding is that patients oftentimes don't know the difference between quality of service and quality of care, or they just assume that they're going to experience quality of care. But I wanted to make sure that we understand that it's absolutely a balance here between quality of service and quality care, and that service quality can actually be a strategic differentiator in a health system, because organizations that deliver this seamless human-centered experience will build loyalty and long-term value and possibly even drive positive outcomes that you're looking for on the other side with quality of care.
Now we get to the solution, right? So I have a colleague that says, we've admired the problem long enough. What are we going to do about it? And one of the things we could do about that is to align around a vision. And we'll get a little bit more into the how and the playbook of the matter. And Jill's a real expert in that space. But I'll tell a brief story about an experience we had here recently, where we're trying to articulate what the digital vision of Hartford HealthCare is going forward. And there's a lot of questioning around the Google Cloud journey we're on, and why aren't we moving faster here? And what about this over there? And people telling different stories of what they think we're trying to accomplish. And ultimately, I came to the conclusion that what we really needed to do was to set a vision, and to do so in video form that really showcases the various connections from different technologies and physical spaces that, I think we all assume, just as people in the world that interact with digital and physical spaces on a daily basis. But when we're in the weeds in healthcare, we often forget to focus on those items, or they're left over to the marketing department or some new digital or innovation department. It's not really looked at holistically. My aim and intent was to aim directly at the top leadership, and then to communicate down through all leadership, and then ultimately through the entire organization. So we created this series of vignettes. And what I think was really interesting about that is, in this series of vignettes, the small piece, 10 seconds, was a patient entering the garage facility in one of our major campuses in a major metropolitan area. And we know through studies over the years that our patients in the outlying communities have a lot of anxiety about coming into the city and about parking and about getting to their actual appointment. This has been shown for 20 years now in research. We know this. It's only getting worse. So there is a moment in the video where the patient drives up and she has a companion app, and it tells her what floor that there are open parking spaces on and what side of the parking garage to go in, and that we've reserved a space for her because we knew in advance she was on her way, which we all do know. It's in the data. We just don't build those experiences. And a crowd of 800 leaders throughout the system just spontaneously erupted in both cheers and sort of joyful laughter, which was amazing. Because what we did was we found a milestone, a moment that matters, that is not always articulated when we are studying the operational challenges that we have internally or these point issues that show up in our CAPS or HCAPS data, right? It's just invisible sometimes. We intuit it, but we don't usually work on it. So here's what's great about that. We took this approach, and that absolutely began to drive alignment throughout the organization because people can see it, right? Experience is a language that people understand. And when you can visualize it for them and tell a story, they coalesce around it, and then they make that story their own. And then they go tell that story, and then they work in alignment, and it builds momentum for the level of transformation that we need to make in healthcare around experiences and digital transformation. And once we do that, it begins to prioritize the investments we need to make because everybody's on the same page around the vision and the experience that has been outlined. And then that begins to mitigate the risk of project failures and rework and investments that don't pay off and don't improve the lives of our colleagues and our patients. Jill?
It also points to when we're always trying to measure experience and with all those logos that I just shared before, or like get our finger pinpointed on it. I remember that story. I wasn't there with you when you presented that, but that 800 people just cheering and screaming about that one moment and just saying, you just collected qualitative data. We know that's an important moment. And so how do you know the importance that matters, and how do you use that qualitative data to drive what people understand to be the experience? It was just such a palpable moment. So thank you for sharing that.
I come previously from the marketing and communication space before I took over the digital services for Hartford HealthCare. I was in digital strategy, but I spent my life in marketing and communications. So I had an understanding and an idea of storytelling and how that helps. But as we learned from that, I found myself again in a meeting where we are looking at a new building. And as we're going through this exercise, there's just a menu of technology options that I'm looking at. And it reminds me that, once again, we're not focusing on the experience first and being intentional about what we want to deliver so that we can design the technology to fit the intended experience. And it also then reminds me of a major project that I am currently working on, which is oftentimes we go for point solutions in healthcare. And we did that at Hartford HealthCare, and it's a great partner. I'm not going to name names, but they helped us communicate things like appointment reminders and e-check-in and fast pass and all of these things that are really helpful. But ultimately, we were then over communicating to people. We were sending things out of Epic and MyChart that crossed over from this third party. And we were actually causing a burden and over communication and sort of confusion to our patients because we weren't intentional in how we designed our communications to them and how we navigated them through their experience. And it was nobody's fault, just a lot of really good and well-intentioned people solving problems one at a time in an organization, which then leads to ultimately an inability to tie these experiences together in a planned and an intentional manner that actually helps solve problems for patients. We actually solved problems for ourselves instead of for them. And I love this framework because it helps to organize the direction in which you need to sequence these things so that you can design intentionally. So I'll just pass that back to Jill.
Yeah, no, I love that story because I think it really, this is like the hill I die on every day. And I love and I share broadly is that we really need an intentional design for how we're thinking about experience and how experience flows into the various decisions that we make as organizations. And I tell you, that's exactly it. When you start at this sort of experience layer and work your way backwards, rather than sort of starting in the middle with, okay, well, I saw that we want to increase our mammogram screenings, for example. You could throw something like that out there. And they're saying, I know what we can do. We can text our patients. And they start to think about what technology that they want to put in place to do that. And so they really are starting here at this digital layer. And then what happens is that it becomes this fragmented story that Dan just told so eloquently. And it also helps you to think about, well, what other digital tools already solve that challenge? What is the patient actually trying to do? Or what are we trying to influence the patient to do in order to take great steps for their care? What is it that we want them to experience? And then what are the technologies that will service that? What do we want them calling us? Do we want them to engage with us digitally? And just making those kinds of decisions rather than just sort of looking at each point solution or at each problem independently. So I really love this sort of intentionality in how experience can help us drive those conversations forward.
Jill, without naming names, I will say I'm left in this position of having to inform people who have become friends of mine that we've been doing business with for a number of years that did great work with us during COVID, for instance, that we need to unwind their contract and their services because ultimately it didn't serve the greater experience that we are attempting to offer to our patients. And now we're rebuilding it using foundational tools that actually deliver on those experiences that cross from one channel to the next, one experience to the next. And it's unfortunate. Those are hard conversations, but those are the kinds of hard decisions and conversations we need to have. And we need to try to avoid the trap of the point solutions and looking for technology on an individualized basis to solve problems instead of starting with the experience. So that's a real lesson for us and for everybody. I'm sure if you're in healthcare, you've done this before too.
I remember, Sarah, we were talking about this before, and I think you congratulated Dan for being brave enough to do that.
Well, what stood out from what you've done is that we are so often asked to back into a strategy based on this whole pile of point solutions. And Dan, I'd asked you though, is how do you give yourself space to extricate, using your words, the philosophical approach to design in mind? And building for the future 5 years from now will be significantly different every year because the way technology is advancing. How are you implementing that sort of ethos and perspective into the work you're doing at Hartford?
Yeah, it's a difficult question. I think in this particular case, and I know you're asking a broader case, and we'll get to it again later when we talk about our building project, which also leads to the same question. But in this particular case, I was laying the groundwork for about 18 months before I finally was able to do the unwind and then pull the trigger. So there were a bunch of things I did behind the scenes. I transferred the budget. I communicated the challenges. I created the ultimate vision, which explains where the gaps are in experience. And I did the groundwork. I did the legwork in order to move the organization and then extricate ourselves from what was a great point solution in the moment, but ultimately doesn't serve the greater experiential vision that we have. So it was a lot of pressing the flesh and a lot of communicating, a lot of storytelling, and also some maneuvering behind the scenes to ensure that I had the ability to do it, frankly. But ultimately, it's a philosophy many of us have, is where you can centralize in your experiences and your technologies, do so. But also, no matter what you do, try to take a component-based approach so that you know you can plug and unplug. when the technology gets better. So it seems like I'm talking out of both sides of my mouth, because on one hand, I'm saying if you're with Epic, right, or if you're with Cerner, you're Epic first, you're Cerner first. And once you take that path, it's almost impossible to extricate yourself. On the other hand, you can do that if something better does come along, or if it turns out that Salesforce has solved the problem and AI creates the best CRM through Salesforce ever. You can begin to sort of move those components into place. And as long as you design it with that intention in mind, and then you really think about that strategically, that's the approach that I think works in the end. And that's what we've shifted to over the last couple of years. And I apologize for all the vendors out there, but I know that's your job, is to expand your suite of products and services with every client. I get it.
Yeah. And I was just thinking too, thinking of that service model that I just shared, it's really about the experience, then the operations, and then the technology. And so I think, Dan, really appreciated is how you've adopted that so well in your environment, where if people are coming to you with a technology decision, you're like, okay, well, show me how that connects up to the experience vision that we've articulated. And so we've articulated it for patients in various acuity zones within your health system. We've articulated it for the built environment, for that's acute spaces. We've started to articulate it for some staff and colleagues, and we've been talking about articulating it for knowledge workers too. And so it's sort of like, how do any of these decisions impact all of those operations, and then ultimately what happens to the experience? And so if you define the experience first, then it's easier to have those conversations, because everybody has agreed to some extent that's the right vision for the experience that we're targeting.
Yep. Where does that product fit within that experience that you've designed? And just a final statement on that is, what's your exit plan? So not every solution can neatly fit into everything we just outlined, but it's something that has to happen. And you may have to take an innovative startup approach, and it may not connect to all the systems you want. That happens, right? And that allows you to be a little bit ahead of the market sometimes, but you need to have an exit strategy so you can move off of that and into a more strategically interoperability, integrated approach that serves the ultimate experience. And if you're not thinking about that, you're going to end up being in a sticky situation where you're stuck with some, now at this point, legacy technology that is hampering your ability to move forward.
And so this is critically important, especially when you're thinking about buildings and laying out the groundwork for how buildings come together. Do you want to give a little context of the building experience visioning work that we embarked on together?
I sort of alluded to this earlier before I went into the discussion about communications technology. So I'll keep it in brief here. At one of our major campuses, our flagship campus, we are aiming to redesign the physical spaces and then the experiences as well. And I found myself in a meeting with some futurists and some architects, and we're just going through a litany of different technologies. Touchscreen that, waiting room this, and device that, and just on and on. And it's wonderful stuff. And I'm glad that we had the opportunity to see this. But while we're doing that, I started texting back and forth with my Chief Information Digital Officer, Joel Vanko. Here we go again. We're putting the cart before the horse. We're being asked to pick technologies without first envisioning what the experience that we aim to deliver is. So at that point, we basically put a pause. We actually brought Jill in to go through an experience session so that we can align around the experiences we want to deliver, and then choose technologies that can fit those experiences so that we can mitigate risk around technology being the source of delays or potential unmet expectations because the expectations were not clear, for instance. So that's a challenge, though, because as Sarah pointed out earlier, with AI, for instance, right now, we don't know what technology will be capable of in 3 years. So you have to be really clear about how you're going to take, again, a sort of a component approach so that things are flexible, and then you can swiftly move them out as technology changes. Easier said than done. I'm not going to tell you I have all of the answers, but we're aware of that and we're designing around experiences instead of the technology. And the technology is only there to serve the experience.
So as Sarah mentioned, my background is in human-centered design. I've been doing this for 20 years and was doing it in industry and medical devices, and then for 10 years in a health system. And so there's an amazing report that you should all check out called The Role of Design in U.S. Health Systems. And it features 27 various health systems that have some sort of design and experience design capacity within their ecosystem. It sort of surfaces what kinds of challenges and problems they solve. So the problem that we're trying to solve that Dan just articulated is around like what technology is going into this new space. And so it's Institute of Design at Illinois Tech that wrote this piece, and you can actually see some of my work in that document. But then also, okay, that's the discipline of human-centered design. We know how to surface the right problems. We know how to engage and test with patients so that we're confident in the direction that we take. And then we put this into the rigmarole structure of Google Ventures sprint process to really hone in on the experience. So that's kind of the formula or recipe for how we do that work. So Dan was a strong champion in all of this. This is something that he thinks about all the time. It's an interesting career path to go from marketing and really trying to understand the psychology and influence of how patients think about these challenges, what their behaviors are, and into this digital role. And so just a strong person who really got it, that experience matters and that we need an approach to solving this. And then I think also wanting to point out that this built on some prior success that we had. So like I think I mentioned in an earlier part of this conversation that Dan and I have spent some time together mapping out a number of journeys and have seen the value of this. And so there were other executive sponsors who had been a part of what it's like to do human-centered design. And I only sort of pontificate about that because some of the questions that came in is like, how do you get this started? How do you get the buy-in to be able to do this? And so some of my advice, if anyone's looking at building a new building or solving any problem and putting them through this discipline and recipe, is really to start small and prove the value of focusing on experience. So we had that leg to stand on. We also had other information about our patients coming into this sprint process. As part of this work, we engaged with our stakeholders broadly. So we looked at not just the folks that were going to be impacted by the new space, but we looked cross enterprise and sort of talked to folks that were stakeholders, especially at the leadership level, not just to understand what their problems were, but to get that buy-in, get them on the buy-in on the approach and on the outcome of why an important experience, the importance of defining this experience. We also spoke with frontline and stakeholders in the various folks that were going to be in the new space, and we did observations and all of that. And so that really helped just sort of create a wonderful context for how we would do the session, what problems were needing to be solved. And I think what was amazing in getting that buy-in and aligning those stakeholders up, it was really this moment where they said, okay, well, we're excited to do this for this particular building, but also let's use this as an opportunity to set the standard across the enterprise. If we use this to say, those buildings take 2, 3, 5 years to build. And so how can we get started now? What is that experience that we're trying to deliver? How do we set the pace and vision for the organization? And so as part of the sprint methodology, I'll pause there. Did you have anything to add, Dan, before I jump into like what actually happened in the sprint?
Yeah, I just wanted to mention that the boldness of what we were attempting there, just to put a finer point on that. While we were in the room to outline a number of experience journeys, we were also there to try to understand how digital technology and virtual experiences wrap around that physical location experience. Because care is one small component in a physical space of a life event that spans months, weeks, days, hours, whatever. And you may only be in that space for a small amount of time, actually, and less time as time goes by, right? That's by design to keep people out of the hospital. So I have this concept of the digital campus. We're talking about a hospital campus, a physical space. But what about the unseen digital campus and all of the infrastructure that is necessary, just like you need sidewalks around campus to get from A to B that have to be sort of designed based on what makes sense for people. You need to do the same thing digitally. You need to have those API pathways, and you need to ensure that the physical space can actually house the digital technology. Use all of those things. So the vision wasn't just about how to care for patients, visitors, and deliver optimal experiences for colleagues in this building. It was also, what about the entire campus? What about all of our campuses over the next 10 years? And oh, by the way, how do we create a seamless experience that wraps around them using digital technology and use this opportunity to inform the investments we need to make?
This question comes up often around how do you know you've captured the right experience or the right ideas? And as part of the way that human-centered design and the sprint methodology work, it really prevents groupthink, and it really has this work together but yet alone concept woven into it. So where there's silent voting and independent time to actually have time to think and draw what you want the future state to be, and then to pull them back in and to say, okay, now that we know what's really important and what we love about what everybody else proposed, how do we work together to then define the future state experience? But, really the work focuses around what are the moments that matter. And so for the building that we're working on here, there's 4 kind of steps in this journey. It's whatever happens before you get there, as you get there, the care experience itself, and then also what happens after the care moment. And in our work, I think this is obvious. And I think Dan talking about the digital campus and how this is so critical in a future state vision for an amazing built space is that you have to remember that everything around the care event is equally as important. And parking was hilarious in sort of this sprint, because some folks had been at the leadership meeting that Dan had shared at the beginning of this seminar and had seen what the future state vision is. And so they were really thinking about parking. And of course, they live it every day. They park on campus and they experience it. Their patients are late and they have to shift their operation to make up for the delay in care and the uncertainty that it brings for not knowing where to park. And so parking ended up being a major theme, as you'd expect, in all of this. But also, what is around parking and what does that mean? Then also setting the tone in that vision that Dan talked about too, is that they had a concept of having a digital health companion throughout your journey. And that surfaced and wove its way in, is like, how do we have this like companion mentality throughout the entire journey that we have with patients? Dan, if you want to share how this helped us think about the technology and how storyboarding really helped understand what we were looking to accomplish from a technology perspective.
I'll start with the concept of the Russian nesting dolls that many of us played with if you're old enough as a child. There's this idea of, okay, there's pre-care, and then there's arrival, and there's the actual in-facility care, and then there's transition and aftercare. But if you double click on any one of those, you're going to find another 10 things. And then if you double click on any one of those 10 things, you can create 10 more journeys within that. And then there's branching logic. I don't say that to overwhelm you, but just to say that that's kind of how it works. And you really need to vision out these individual items, and which is what you're seeing there. But what was really interesting about going into this building design sprint session was, as Jill said, the earlier design sprint that we did on a digital sort of innovation technology that we're working on, as well as the vision video for what a digital experience could look like over 4 different people and their experiences in the leadership summit that we created. Those thoughts and those concepts that were sort of originated independently of this process were embedded in the thinking, in the psyche of all of the people that ended up in the next sprints. And they started referencing those other sprints and those other concepts as key parts of the journeys within this latest sprint, which was incredible because you can see the culture and the thinking change when you start to look outside in and you focus on experience and outside perspectives. And then to witness that happen, I was like the cat with the canary, just trying not to smile in the corner of these sprints as I'm watching things that we came up with. Other people are drawing them out on little sticky notes and saying, oh, this has to be here. This is what we're going to do. And to make another point is that by doing that, it begins to surface up the individual technical requirements necessary to then meet those experience needs. And then from there, you can look at your suite of available products and applications and skill sets and services that you have, and then ask the question, do these solve the problem? They solve the problem forever or for a long period of time, or will it be an interim solution as a bridge to whatever comes next? Or do we have to go out and then do some RFPs and then find the solutions that fit? And so now you can see how we began solving the problem of what technologies do we need for this new building, and surrounding sort of digital campus concept technologies do we need to make this vision a reality, which is compounded over time and embedded within the culture. So I'm no longer just looking at a Teams screen of a bunch of Hollywood squares and then saying, well, I'll take that and I'll take this technology and I want that technology. We now have a playbook, we now have a menu, and we now have a recipe. And so we know what to shop for, and we can look in our cupboards and we can say, does this work or is it expired? And do I have to go find a new one? Do I not have that ingredient at all?
Yeah, and I also just think that it also surfaces what's the operational and sort of care model type questions that need to be addressed as you think about, we also used to say the tail wagging the dog. So when you pick the technology first, then you, in many ways, hard code what kinds of operations you can have, and then that hard codes what kind of experiences or the degrees of freedom you have in actually shaping the experience. And so doing it sort of this way, it allows the operational team and the clinical team to have their input in what kind of experiences they want to deliver. And so a perfect example of this is, of course, as part of the care experience, you start to see a whiteboard, right? And how does that whiteboard work? And all kinds of technologies are coming together into this whiteboard space, workflows that weren't integrated before. And they're starting to ask themselves the questions, which is awesome. They're probably asking these questions before, but now they have a structure to ask these questions around how are we going to enhance our workflows? How are we going to take, I love one of our colleagues, Barry Stein, always says, don't improve the workflows, take the work out. And so, of course, that's where you start seeing automation and augmentation. And one of the questions that came up in the notes that were shared with us ahead of time were around, how are you using AI? How are you thinking about AI? How are you using that to drive operational efficiencies? And so what I really love is, rather than jumping to the technology of how you're going to solve for, is like, what's the work that needs to happen and doesn't need to happen? And then, of course, there's tools like AI that can help us automate or can improve the efficiencies of the workflows that exist. So it's really about what can you automate.
Just throw in too, what you've presented, 3 of those 4 items were outside of the care delivery setting.
That's right.
If you can help people understand what the next step is and where they are in the journey, and then you could guide them through that, you are going to remove the anxiety that they feel. And just by helping navigate them through that experience and removing those anxieties, you can actually move the needle on experience and improve people's lives, frankly. And that's what we're trying to do. And most people, once they get into the care environment, they're happy with it, right? They feel cared for. They sort of give over control, and you go with the flow when you're in the care environment. But it's all that stuff ahead of time and directly after, and the questions that you have that are not answered and you don't know who to go to. And let's be real, trying to call a healthcare system is not very easy. So the more you can design that into your approach ahead of time, the better your experience is going to be. And it's hard. I know it. You got to map it out. You got to find those moments that matter. You got to get the answers, and you got to surface it to people at the right time, in the right place, and the preference that they have for their communication, for instance. But it's really key, I think, to solving the equation.
Yeah, and I just want to highlight too, where's the patient in all of this, right? You're probably wondering in the methodology, and I saw some questions that had come in around how are you soliciting patient feedback? How are you including them in the design, et cetera? Patients and also frontline staff, I would expand it to cover both of those pieces. And so just really thinking about how are you engaging them? How far from the vision is your current state, and how are you engaging them and getting you there becomes a core piece. And so as Dan mentioned earlier, sort of in this last piece, is you've created the alignment, you've created the momentum, you've tested with patients, you understand the gaps, you understand what they're excited about. We use great frameworks for that, like I wish, I wonder, to really get a sense of what's important to them and what's appealing to them in this sort of work. So now you have all of that and you've built some great momentum. How do you keep them involved in the process as well? And then this sort of goes beyond any implementation if you're talking about digital space or you're talking about hospital. Once you do the ribbon cutting and you're in the actual hospital space, really just thinking about, if I could boil it down to one question that captures, did you nail it with service quality, is how easy or hard did we make that for you? And how did we help you in your journey? And I don't think those questions are asked in broad strokes across very many health systems of, did we make that easy for you?
What's the validation mechanism you use with your patient advocacy groups, with the expectation of, we heard you, we designed this, and then it's in production, et cetera? What's that feedback loop look like with actual patients?
Yeah, so what we do is in the beginning part of all of this is that we use them in capturing the current state. We understand what their pain points are. Then you do these sort of design sessions. In this particular case, the building, it was confidential at the time, so we weren't able to bring patients into the actual design process, but I would have loved to have done that. And I definitely say, if you can, bring those folks in early.
But Jill, we did do that with an earlier sprint on
That's right.
technology that we've been working on. That is the way to do it, is surface up those folks who've already raised their hand and they want to work with us and learn from them. And they're usually very happy to engage with us.
Exactly. And then then you sort of bring it to them and you gauge importance, appeal, and reach, how easy and hard, and just work with them through every step of the process is how you just keep collecting your yeses and your validation and you build off of it. The other thing is, in the human-centered design world, a lot of it is thematic research. So building on themes that you're seeing and sort of saying, okay, well, we're grounded in this particular concept. How can we improve this problem or concept, and then like move the patient forward? And one of the key pieces that how we do that is through consulting speak, but sort of importance, appeal, and reach. How important are the problems that I'm solving for you? How appealing are the solutions I'm laying out for you? And then reach is probably the most important question, and it's how you ask it and how you finesse that question. But reach is really about, can they imagine themselves in it? Can they imagine it for others? Do they start building on the ideas that you're presenting to them? And that's sort of how you know you're in the right direction. So I've had patients say, I don't like all that tech, I'll never use it. And then they'll say, but I can see my cousin using it or my mom using it. And I've actually followed those patients in their journey and have seen that they become the biggest advocates for the change. And that not only did they say that they wouldn't be a user, they're actually an advocate and an evangelist of the actual technology.
How do you also manage the financial implication? So you're like, we have this beautiful outcome and it costs X or Y or Z. Bringing that back, Dan, to your board, to Joel, to others, how are you managing? This is the perfect version. Here's how much it costs, and here's how we are going to finance and even measure some of the value creation from these types of endeavors.
That's a great question. I'd love to hear somebody from the audience answer it, because I don't have an answer. No, I'm just, so there's a square foot an average, like for building, and there's a technology allotment within that. And we have to work within those constraints. So on some level, there's an element of shoot for the moon and get to orbit and ensure that you're moving in the right direction. And then you're making solid progress, right? More platitudes. Don't let perfect be the enemy of the good. So we want to at least say and state what our ideal experience is, and working within the confines of what we have. And then, by the way, advocating, which I do often, and sharing and evangelizing that we need to make more investments through all of my leadership, and then ultimately getting as much as you possibly can to get as far as you can on that vision. I'm not going to sit here and say that just because we created an experience vision that's been validated by patients and by actual science, that we're just going to simply be funded. That's just not reality. This is healthcare. We're a not-for-profit organization. We have the same financial pressures of anybody else. And then I'll also freely admit that this department that I've started is only a year old, and we're still staffing up. And this is the first year that we've begun working with Pixel Health. So we are still in the kind of advocate for this approach and the resources to get it done mode. And as I've mentioned, I've witnessed the culture coalesce around it and rally to it. And our leadership is now singing from the same songbook that we are, which is great. So we haven't solved all of our problems. I can't tell you we have everything we want and that the ROI is there right now, but we're working in the right direction and we're doing right by our patients and our colleagues. So I'm confident that this is the right thing.
Yeah, and I just want to add to that too, that the experience brief that we've put together makes its way into those conversations as well. So like, I think that's the interesting culture shift is around when we are talking about investments, when we are talking about the research, the design, the feedback makes its way into those conversations. And I think you've done an amazing job of carrying that forward.
That was not always the case, right? It was just facilities discussions, IT discussions, operations, and you didn't really have this experience voice in the room that would help people understand how far you can go and where there are trade-offs. And it also then points you to larger investments needed across the system, let alone in one single product or one single building. And it gives you that visibility, and then it drives that alignment, which is the most important thing. Above all, that vision and then laying out that experience helps move the organization to make the right decisions, or the decisions that I perceive to be right.
And I also think your point about your team being young as well is just sort of thinking about you've put experience design, that you've augmented your team with Pixel Health, but then you're also building your team of UX designers and folks that have a research and design focus. So sort of referring back to that role of design in US health systems report that I just named here too, like just thinking about design and experience design as a discipline, just like we think for marketing, and putting that rigor and that science around how you talk about experience and weave it in. Think about experience designers, experience researchers, as well as service model designers is just a tidbit of information I should share.
And I'm glad we've been able to weave in all of the questions throughout the presentation. And before we wrap up, I just want to thank our panelists. Thank you, Jill. Thank you, Dan, for sharing your time and expertise with us today. Your insights have been incredible and appreciated for sure. I also want to thank our sponsor, Pixel Health, for making this event possible. Their support allows us to bring these critical conversations to our healthcare community. Again, thank you to everyone for joining us, and we look forward to seeing you at our next webinar. That's all for today. Thanks for listening to this week's Keynote. If you found value, share it with a peer. It's a great chance to discuss and in some cases, start a mentoring relationship. One way you can support the show is to subscribe and leave us a rating. If you could do that, we'd appreciate it. Thanks for listening. That's all for now.